Sometimes as a mom, you don't need therapy. You just need a change of zip code. For that, we headed out to Island Oaks RV Resort. But it's not just for RVs. They have so many cabin options, including some with your own personal dog area or playground. And every cabin has a different theme, so each visit feels new. We started by grabbing a golf cart for quick access to the pool. Looking for more fun? They have plenty of options, including a water obstacle course. And when your belly starts grumbling, stop by the on-site cafe or pop into the general store for snacks. If you run out of clean underwear, no need to worry. They have multiple laundromats on site. I might still be the snack lady, but at least my son never gets bored while here. We can't wait to go visit again soon. Here's some things you should know if you have a baby or you ever plan on having any. Some crib mattresses have different sized based on your baby's age. Like this one says, use this side for infants and the other side for toddlers, so make sure you check that. When it comes to swaddles and sleep sacks, you will often see a TOG rating, and that stands for thermal overall grade. And what that is how warm their sleepwear is. So if it's like a 0.5, it's a very thin layer of sleepwear, and then the higher the number, the more warmer it gets. You can look up your specific brand's TOG rating on their websites, but it'll tell you based on the temperature in your house, what kind of TOG rating they should be wearing. If you like to keep it cold in your house or it's winter, you might need a 2 or a 2.5. Just look it up so you know what you actually need and baby isn't getting too hot or isn't too cold. If you're using bottles, pay attention to what size this is. I don't know if you can see that faint number 1 right there. The type of bottles we use go from preemie, so they'll have a P on them, all the way up to a 3. And this is going to change the flow and how fast the milk comes out of that bottle. So when they're young, you're probably going to start at a 1. And as they get a few months older, you may find them getting more frustrated with the bottle. And that's probably because you need to size that up to a 2 or a 3.
So it's great to finally see you again.
I know, it's been too long.
It really has.
I've been wanting to meet this one.
I know, the new edition.
So cute. How's that been?
It's been great. It's been a roller coaster.
I know, I remember those days. Were you guys trying or a happy accident?
Me and my wife, were we trying?
Yeah.
No, we were, yeah, you
Daddy,
could say
what's
that.
When'd Danny go? Oh, I don't know if they have Danny go here.
Well, do you guys watch Danny Go?
We watch Danny go.
Okay, then yeah, absolutely.
Maybe ask Miss Brittany nicely if she'll put on Danny Go.
Miss Brittany, can I watch Danny Go?
Definitely, I will sure put on Danny Go for you.
Only if that's okay. If that's okay.
That's totally fine. Morning, afternoon, evening, sometimes it's good.
My TV's on 20 hours a day.
Oh. Wow, look at him go.
Yeah.
So much energy.
Yeah. Maybe they'll take a nap.
Yeah, we stopped doing that a long time ago.
Yeah, same. We saw him live.
Yeah?
Yeah.
Did you have so much fun hanging out with your friend?
No. Okay.
So did you have fun with your new friend? Huh? Who? Okay.
Mommy, I'm tired. What? I want to take a nap. Since when do you take naps? I just want to lay down. It's 10 a.m. Okay, I'm gonna go lay in bed. Okay, yeah, buddy. Go ahead. Okay, let's get to work. Here's a list of postpartum tips and warnings for all you expecting moms out there. First is the night sweats. So bad. I would wake up in the middle of the night and have to change my clothes and roll over to a dry spot on the bed because I sweat so badly. Second is the stink. Even if you've just taken a shower, you feel like you always stink. This doesn't apply to everybody, but many women it does. One of the most common ones is you just feel like you smell like onions all the time. Waking up in the middle of the night in an absolute panic because you feel like you've lost your baby in the bed. Even though your baby has never been in the bed, never slept with you in the bed, they sleep in a bassinet or their crib, you just wake up having this anxiety that you've lost them in the bed somewhere. Phantom cries. The amount of times I would wake up or be in the shower and think I hear my son crying when he wasn't crying at all. Rage, just because you're exhausted and your hormones are so out of whack. Yeah, there's a lot of that. Is it normal? I don't know, but maybe let your spouse know and be prepared that that is something that can happen. And last, I don't know if this is common, but at least it happened for me. When the sun went down, the anxiety that would just set in knowing that everybody was about to go to sleep, but I wasn't going to sleep very much. And I'm not trying to scare you. I'm just trying to prepare you for the things that happened to me. I see a lot of first-time mom pregnancy questions on my pregnancy app, so as a second-time mom, I thought I would answer them from my perspective. Again, this is just my experience. Everybody may feel a little differently. First up, the glucose test you do in your second trimester where you drink the sugary drink and you see what your levels are to determine if you have gestational diabetes. I have no problem with it. I like the orange drink. It's kind of like a semi-flat Fanta. I think it tastes great. I have no problem drinking it, so if you're worried about it, I wouldn't worry too much. Coming from an American, don't be surprised if you don't get to see your baby that much. You don't get very many ultrasounds unless you're high risk. But if your pregnancy is just going totally normal, nothing to worry about, you typically get
2, maybe 3. I had a growth scan around 30 weeks, but besides that, my anatomy scan and my initial, hey, I'm pregnant, let's check on baby, that was it. I've had 3 ultrasounds my whole pregnancy. Totally normal. When you get to 39 weeks, they may ask, or you can ask them about a membrane sweep. This is basically where they go up in there and stir some stuff up a little bit to get labor moving along. I think my doctor told me there's like a 50% chance of it actually working and putting you into labor with my first, and it did. About 12 hours after the membrane sweep, I went into labor. I will tell you, it hurts like a mofo. At least for me, it was very uncomfortable, and afterwards I was very uncomfortable and crampy, but I was also tired of being pregnant and ready to get things moving along, so I would do it again if I had to. If you are in the thick of temper tantrum central with your toddlers and just at a loss at how to handle them, here are 2 things you can do to reduce them significantly. First is try and reduce the amount of transitions you have. So what I mean by that is think about when you wake up in the morning. As an adult, you're like, all right, I get up, I brush my teeth, I eat my breakfast, I get dressed, whatever. You have a list of everything you need to do and you just get it done. Whereas your child just wakes up and goes about their day doing whatever. Routine definitely helps, but constantly taking them from one thing to another leads to more temper tantrums because they may be playing and you're like, okay, now we gotta go get dressed. Okay, stop getting dressed. Now we gotta go do this. So it helps if you can combine them. So while you're changing their diaper, give them a toothbrush to brush their teeth. While they're eating breakfast, do their hair. The more things you can combine together, the better it will be for them. And 2, and probably the most important, is let them feel in control. Now, I don't mean when they're having a meltdown, like let them have their way if you don't want to give into something. But like if you're outside and you want to go inside, instead of being like, hey, we're going inside, be like, hey, do you want to help me close the garage? Give them something fun to do and let them think that they're in control of it. It works 99% of the time. Hey buddy, food's ready. What is that? It's noodles, just like you asked for. No, I meant the other noodles. What other noodles? The ones I was thinking about. Oh, okay. See, I'm not a mind reader, so you get spaghetti noodles tonight. Bleh, I don't like those. Hey buddy, here's your blueberries you asked for. Thank you. Why are they blue? Because they're called blueberries. It's literally in the name. Bleh, I don't want them. Are you serious right now? Mommy, can I have a banana, please? Here you go, dude. What is that? Oh, it's just a brown spot. I'll take it off. There you go. I'm not hungry. Oh, I didn't even want a banana. Hey, buddy, what are you eating? I found cheese over here. Okay, I'm just gonna start hiding food around the house for you to eat then. Here's how I got my toddler to stop just randomly running away from me. For starters, it is a lot harder and a learning process at a younger age. So like this commenter said, their child was 14 months old. If they see something they want to go after and they're not looking at you, they're probably not hearing you if you're calling after them. But here's 3 things I've implemented and my son has learned over the last year to help with that. 1, if it's not safe, you're holding my hand, you're in the cart, I'm carrying you, one of those is happening, period. 2, as he started to get a little bit older, I'd say around 18 months, I started giving him something he had to do. So hold the cart or hold my hand, whatever I was telling him. And if he chose not to listen, that was his only chance. He's now riding in the cart. Or he's now getting carried, or he's going in the wagon, whatever option I have to remove him from just running away from me. Because if you don't listen the first time, we're not trying again. You're gonna have to practice this a lot for them to understand it, but as they get older, they're gonna realize you're serious about what you say. And last but not least, but probably my favorite one, is we taught my son what stop means. So he would wanna run and we'd be like, cool, run. And we'd let him run 10 feet and we'd say, okay, stop. And it took a lot of practice, but now we can let him take off, somewhere safe, way off in the distance in a field. And as soon as we say stop, he stops. And it's just demonstrating for them. You run and you stop. You run and you stop. So you show them exactly what they need to do in that moment. This one does take a lot of practice, patience, and understanding on both ends, but it does pay off. If you're having a C-section and you're curious how it goes, this was my process for a scheduled C-section. We elected for a C-section with my secondborn because my firstborn got stuck. He had what's called shoulder dystocia, which is potentially life-threatening. It's very dangerous, and the risk of having it happen again is higher the next time around. So we just went ahead and followed doctors' recommendations to have a C-section for any future pregnancies. So for the process, we were told to be to the hospital by a certain time. We had to get there 2 hours before my appointment. As with any surgery, don't eat or drink after a specific time. They will tell you what that is. We checked in. They took us up to the room that we would be staying for the duration of the hospital stay after the surgery was done. So we were able to leave all our stuff there. They gave me IVs. They did some blood work. We were there for about an hour, hour and a half, which is why they want you to get there early, asking you a bunch of questions, just going through all the basics before your surgery. They then wheeled me down to the OR. My wife had to wait in a waiting room while they got me all prepped and ready with a spinal block put in. The spinal block is similar to an epidural in your back where you hunch over, same process. It doesn't hurt. Personally, I thought it just felt like a regular shot. I will tell you what hurt the most in a minute. You will very quickly go numb from your chest down with the spinal block. They will lay you back and they will start getting everything prepped and start the whole procedure. It's a really weird feeling being numb because you will feel like tugging. It doesn't hurt, just like somebody grabbing you, and your body may be moving around a little bit, but you literally can't feel any pain. Just so you know, you can't see anything that's going on. They do put like a sheet, a curtain in front of your face while they're doing the whole surgery. The whole process took about an hour and a half, and we were all brought back up to the room. The most painful part of everything is what's called a fundal massage, and this is where they come in and they literally rub your belly where you just had surgery. This helps your uterus return back to its normal size and make sure you don't have any clots in there. They're just trying to get it all pushed out and moved around. Between that and the fact that your recovery is a little bit longer in terms of like what you can pick up, and you now have a wound on your belly that has to heal, that's really my only cons for the C-section. Pros, it's scheduled, it's fast, and it was not nearly as traumatic as my first. Mommy, help! Help! Come on, dude, I'm just trying to pee. What's wrong? I dropped my cookie. Are you serious right now? Okay, he's good. Hey, buddy, go wash your hands. Lunch is ready. Hey, clapping. What's taking your brother so long? Hey, buddy. Look, Mommy, I cleaned the whole bathroom with soap for you. Here's a list of ways that parenthood has changed me. First of all, I'm not watching any movie that results in something bad happening to children or children's parents. If they lose their parents, I'm not watching it. If the children become sick or abducted or worse, I'm not watching it. I'm basically watching rom-coms and reality TV shows at this point. When I used to have to go shopping by myself, it was like a chore, and I ran through the stores as quickly as I could to be done with it. Now, I am taking my sweet time. I am meandering. You know what? Go ahead, cut in front of me. That's totally fine. Take your time. I used to dislike sitting in a restaurant or fast food or anything by myself. It just felt weird and made me anxious. Now I will absolutely go sit in a restaurant or any place by myself. I don't mean that to sound so negative, but it's one point where I'm not trying to convince another human why they should eat their food. If my wife and I have a date night and my parents are watching our son, normally when we go out to dinner with him, it's like, you know, if you have toddlers, like, let's order immediately and let's get out of here as fast as we can. But if we go by ourselves and the waiter shows up and is like, so sorry, your food's running late, we're like, is it? We didn't even notice. That's totally fine. Take your time. Overall, I feel very fortunate because I feel like going through toddlerhood has made me a lot more of a patient person when it comes to anything in the world. If you can deal with the tantrums and the power struggles all day long, I feel like anything outside of that is not going to affect you very much. If I can give one tip to expecting parents, that you just hold on to this information until your baby is born, because it will save you, it is this. Whatever you do when your baby is born, whether that be at the hospital or at home, however you're doing it, once you've recovered and you get back to your room where you'll be staying in, rest as much as you can, get as much sleep as you can. And here's why. When your baby's born, they're gonna be awake for a little bit, they're gonna feed, and you're gonna be like, wow, this is pretty easy, because then they just go to sleep, and they sleep a whole lot for the next 12 to 16 hours. Depending on when they're born though, come night 2, possibly night 3, they're gonna realize that they are now out of the womb. What is this big scary world? I only wanna be in mom's arms, and I only just wanna eat and comfort soothe on breast or bottle or whatever they're doing. They're not going to want to be laid down anywhere. So between the cluster feeding and the only wanting you holding them, you are not going to get very much sleep at all come night 2 or 3. I remember staying awake until like 4 a.m. until I had to tap in my spouse and be like, I can't sit here holding the baby anymore. I need to sleep. So take that first night or midday, you know, after baby's born and a few hours have passed and everything's kind of settled down, and sleep. If you have kids who use a sound machine and they're not sleeping well, there's some things you should consider. First off is what type of sound are you using? I know I personally don't care for the white noise. We used it for a long time, and every time we turned it on, I felt like I was being screamed at with the constant just static noise. Consider switching it to a brown noise, which is more of a rhythmic, like waves or thunder rolling in. It has different frequencies that change, and it's a lot more soothing. Also, take into consideration how